First of all, I want to thank everyone for joining us today. Obviously, we're here because last Wednesday, the state of Massachusetts designated us as in the red or high-risk district for COVID. We are going to be in the red again tomorrow. I want to first, though, start by reassuring the residents of this city we are on top of this, wherein we have already shown we're capable of handling COVID. We have a fantastic leadership team with us today. Caitlin from Senator Roderick's office, State Representative Schmidt, Carole, Fiola, Alan Sylvia. They've all worked closely with the city administration to stay on top of this and make sure we're properly funded and have all the supplies we need. We also have a strong leadership team in-house with Tess, Curran, and the nurses down in our public health office. They work on COVID almost 8 hours a day, every day. They're tireless. Residents should understand that state and local public health officials need your help to be able to attack this disease. A couple of things I want to talk about a little later that are problems in Fall River, and they do deal with tracing and tracking. Fall River has done around 50,000 tests, a number I am very proud of. I encourage everyone in the city to take advantage of our free and fast testing. If you don't know where to go, call the mayor's office and we'll make sure we have you in a spot. And I also want to talk about another positive. We've slowed our fatality rate. It's been almost a month between residents passing away, and this is a testament to the new hard work of our nursing homes, our hospitals, and our residents. Our healthcare providers have gained much PPE, equipment, and much medical knowledge since March. However, despite the silver linings, our case count is steadily inclining. I want to emphasize that this is a gradual rise. This is not an uncontrollable spike in our numbers. We have been slowly teetering along the edge of red for a while, and on last Wednesday, we fell into that category. The increase is not what we wanted, but it was not unexpected. We are not alone in this number rise. The whole state is experiencing an increase. 2 weeks ago, 20 communities were categorized as being in the red, which brought that new total to 40. And last week, 23 more flipped over, Fall River being one of them, and they now are considered in the red. Our goal overall is to slow the rate of infection. We need strong testing, contact tracing. It has helped us slow the spread, but the entire state is in this new predicament. And the next few months are going to be extremely difficult. I know that we're tired of this, myself included. I love campaigning, and I love my job at Durfee, interacting with thousands of people every day, and I always enjoy being out in the community. And it's very easy to cut corners and take risks when you're as tired as we all are of this disease. But we need to present a unified front and recenter on what the disease is capable of and what it can do over the winter if we're not all extremely careful. We are already at risk of going backwards with our state's reopening plans. We are 1 week into the red, and I can tell you that we will be red again tomorrow. Our goal, and what we need your help on, is please hunker down and be extra careful over the next few weeks. Hopefully, this will keep us from staying in the red for that third additional week, which would cause Fall River to take the step back that we don't want to take. If conditions get worse, the state will then reconsider the rules and regulations that we are now operating under. Our progress over the summer with reopening will be long gone. If we do not do our part to keep Fall River at a manageable risk level, state guidance can and will get tougher, which we know will hurt businesses and our entire community. So we need everyone to remain strong and remain careful. And we can only say it so many times. Wear your mask over your mouth and your nose. I see a lot of people with them down. Spend your time with friends and families outdoors as much as you can. Keep your distance from others. Cut back on non-essential trips if possible, and cooperate with public health officials who have health and safety on our minds. To that end, if you get a call from someone tracing for COVID, take the call. Tell them where you've been. Tell them who you've associated with. People are not following the most basic instructions. We have parents testing positive, sending their children to school. We have people in our community that are sick with a fever, a runny nose, going to work. Those are just absolute no-nos with a capital N. We need your help on these basic fundamental assists that will make the city safer and keep us from lurching forward further into the red zone. When you're in those conditions, if you're stuck, call the office. Do not go to the nurse's office. Don't take your mask off. Go home, call your primary care physician, and take care of that. Don't go out and associate with people, please. We need everyone to remain strong and careful. I know this period of time is difficult, frustrating, and disappointing, and it's sad. This is not how anyone pictured my first term as mayor. I know that in the next few months we will be challenged as we adapt around our new family traditions like Halloween, Thanksgiving, and Christmas while we deal with this crisis. But I urge you, out of respect for the elderly, our veterans, and for those of us battling health conditions like cancer or COPD, please take this illness seriously and do what you can to help manage this rising case count. We in Fall River depend on our residents, our leaders, and everyone in the community to take a piece of this battle and carry it on. And I can't thank everyone enough for coming out today, but at this time, I'm going to turn it over to our health director, Tess Curran, to say a few words.
Thank you, Mayor. And I'd also like to take this opportunity to thank the team in the Health Department, Deb, Leslie, Kathy, and Maria, who have been working tirelessly since March on contact tracing efforts, as well as the Inspectional Services Division. Glenn Hathaway and his team members, Bob and Bobby, have been out in the community working to address any complaints and issues that are arising related to COVID. So they are working tirelessly to keep our community safe. And as the mayor had mentioned, it's critical that we all do our part to help to reduce the risk of disease transmission here in Fall River. The actions of few can impact many. So it's critical that we all kind of pull back and work on the basics to ensure that we're able to keep our community safe. As the mayor had mentioned, within the health department, we're seeing a lot of cases related to individuals who are going out when they're sick. COVID symptoms mirror cold and flu symptoms. So it's critical that if you're feeling any mild symptoms, that you must stay home. That means not going to work, not going and running errands, not seeing friends and family, not sending any kids who are symptomatic to school. This is especially important as we go into cold and flu season. We have to be vigilant, and we have to all monitor our symptoms and stay home when we feel even a mild symptom. Also, it's critical that if you are symptomatic, that you get tested. We're very fortunate here in Fall River to have access to the Stop the Spread initiative. That testing is set up for symptomatic and asymptomatic individuals. So anyone in Fall River or any Massachusetts resident can get a test through the Stop the Spread testing sites. For information on that, you can go to mass.gov/stopthespread and click on Fall River, and you'll see the list of sites that are available to you. It's critical that if you are symptomatic and you have gotten a test, that you quarantine, which means staying home, until you receive your test results. We are also seeing cases where people who have gotten a test and are symptomatic are going out in the community. You must stay home while you're symptomatic and are awaiting a test result. If your test result comes back positive, as the mayor said, we need your help. The health department can't do contact tracing if we aren't able to get in touch with you, and if you aren't able to share your contacts with us. We need people to be forthcoming with their information and to provide us with your list of contacts. Again, your contacts should be limited to your household, those people that you live with. Your contacts shouldn't be your entire, slew of coworkers or your extended friends and family. The people that you live with should be the only people that you are within 6 feet of for 15 minutes or more. Friends and family, you must remain at a distance to them. I understand that that's really difficult. We've all been doing this for a while and we're all getting tired, but we have to dig in and continue to do the right thing. It's like the mayor said, going to be difficult for holidays and as we go into the cooler months where we all have to go inside. But you have to limit your contacts and you have to think creatively in terms of how you can enjoy holiday celebrations and connect with friends and loved ones as we move through the fall and winter months. Because we are in a pandemic, we unfortunately have to modify our behaviors. And I know it's challenging, I know it's difficult, but we must do that to ensure that we reduce the risk of disease spread in the community. And finally, I just want to again remind folks to really practice the basics. Wear your mask. Maintain 6 feet from anyone with that outside of your household. Wash your hands frequently. Avoid touching your face. And if you are able to, get your flu shot. That's also critical. Flu shots are covered by most insurance providers, so if you're able to get your flu shot at a local pharmacy or your doctor's office, that's going to be critical for us here in Fall River. So thank you all for your time.
Okay, I do want to point out we have two charts up here that do show our case count rise and our move into the red. If you see how our percentage went to get us to that over 8% threshold. Again, I'm going to stress this. If you're called by the DPH or by anyone for contact tracing, answer the phone, tell them who you've been with. We literally, downstairs on the 4th floor, we do the calls. People hanging up. They don't even want to know. How do we chase them? Call back, no answer. So please help us with this. Joining us today is the physician-in-chief for the South Coast Physicians Group, obviously at our partner South Coast Hospital. He did want to say a few words. Danny Hackner.
Thank you very much, Mayor Coogan. I want to thank folks for paying attention to this, very abnormal situation we're in, where we want to be close to our friends and family, and we can't. We want to do all the normal activities of life. We can't. Some of us can't even go to work. And yet, it's so important that we focus on the fundamentals. And what are those? As we see the cases rise in the South Coast, in our hospitals, roughly 2 to 3 a week rise in census, we are challenged to stay and not gather in workplaces, to wear masks, but also on the street and when we can't maintain social distancing. We need to wash our hands, and there's very good evidence on hand washing, and there's increasing evidence that the hand washing is essential to preventing spread in areas around us. But because COVID is spread by aerosol and by droplets, we have to be very vigilant in social situations. So church and community gatherings can be very hazardous. We've seen this with the spread in northern Mass, western Mass, in Maine, some super spreader events. And so it's so important for us to be vigilant about those gatherings. Wearing masks is really essential, and you can see me struggle to keep the mask as I talk, but it's important to keep that mask on. Limiting social contact also means looking every week at who we're spending time with. It's really important as some kids are going to school, some in a hybrid format, some with much more time on site, that we really look at who is in contact with whom. But this also applies to our elders and our extended family. thinking seriously about visiting, how close you are when you visit vulnerable older individuals or folks who have might be considered minor comorbidities, things such as mild obesity, diabetes, chronic conditions like chronic obstructive pulmonary disease, and a whole host of common conditions that can put us at increased risk. So I'm wearing the mask here, not to protect myself really, it's to protect you. All of you are wearing masks to protect one another. And it's one of the most important things you can do to protect each other together with strong hand hygiene and avoiding gatherings. And then of course, if you are contacted by the health professionals who are doing contact tracing, share your information. Why would you want to share your information? Well, what we know with COVID is if you seek care early, you're much less likely to have an adverse event. You're much less likely to end up on a ventilator. You're much less likely to end up with a risk of mortality. You're much less likely to have a long-term injury. We know some of the medications that are available are not perfect. The studies are mixed, but some of the studies suggest if we get those medications on early, especially even in moderate disease, we can mitigate some of the effects. So we're asking folks to participate and make sure that they share their contacts if they have an exposure, and seek care. The trouble now in the South Coast region is a lot of folks are seeking care for all sorts of things, COVID, non-COVID, flu and flu-like illnesses. A lot of folks delayed care in the summer and are now seeking care. And on top of that, we're seeing rising cases. So please seek care, be responsible, try and keep the burden underneath that limit of our capacity, our ability to care. And while we do have a great capacity in this region, this state, it's really essential that folks behave responsibly to protect one another. But we saw an amazing response in the last uptick. Not just the providers who are incredible. I'm thinking of folks like Nick Mucciardi, who was the physician of the year for the Mass Medical Society, working here in our ICUs at South Coast, or one of our newer docs like Leela Logue, who helps on our ICUs and our lung cancer screening, or Dan Souza, who's cared for many of these families in this community. But the community showed a lot of responsibility. The community avoided large gatherings, were responsible about mask wearing, stepped up the efforts on hand hygiene, and really stayed ahead of the curve, knowing that this virus finds every crack like water going through, a valley. It has the ability to move mountains. But we do have a light at the end of the tunnel. We're seeing some data on vaccine trials. We're seeing great response to folks in getting flu vaccines. So we do expect in 2021 to have more options available to us. So it's really tough at this point for everyone on the delivery side, in the community, on the receiving side, and of course all the folks in City Hall and government who are trying to serve every day. But if we work together on these fundamentals and we share, there is hope that we can stay ahead of COVID. So I feel very privileged to serve this community, and I really want to thank everyone for keeping their eyes on COVID and this topic. Talk about it, spread the word, keep up the energy. There is hope ahead with the efforts we've made before and the new developments that are underway with COVID-19.
Thank you, Dr. Hackner. Next up is our other hospital group partner, Candace Vieira, Director of Quality at St. Anne's Hospital.
Good afternoon, everyone. My name is Candace Vieira. I'm the Director of Quality, Regulatory, and Patient Safety at St. Anne's. Thank you, Mayor, for giving us this opportunity today to update the community on what St. Anne's and Stewart Healthcare has been doing to ensure that we are safe and ready for our patients at all of our locations. As many have already talked about today, we really want to focus on going back to the basics. Please make sure that you're wearing your masks, that you're washing your hands, and that you're maintaining the 6 feet distance. We continue to follow stringent policies regarding personal protective equipment by all of our staff and also our patients that enter the hospital. Every patient that does come in is screened. Every visitor that comes in is screened. They are provided a mask if they do not have one. All of our staff are required to screen prior to entry and then also wear a hospital-issued mask while caring for patients. At St. Anne's, we know how difficult it has been for patients and their families not to have visitors. We do limit the number of visitors that come in, and we know how difficult that has been, especially as a family member with someone that's been in the hospital. You really want to be at the bedside, and you want to be able to answer questions, but we do have to limit visitors. We are fortunate at St. Anne's because all of our inpatient rooms are private, so that really has been a great advantage to us for our patients and our staff. We have continuously revamped our processes, looking at them from when COVID first started to now. We have different processes in place, so if you are to come in for surgery, we have designated parking spots for patients to park. They call upon arrival. Screening is started at that point, really to minimize the contact time that patients are in the hospital. We also have worked with our supply chains, making sure that we have enough PPE if we do have another surge. If you're coming into the emergency room, we have different processes in place that if you do screen positive, you go on a completely different track, making sure that you're separated from other patients, just making sure that we're safe, we're ready to care for you. We want to maintain being vigilant, making sure we have the safety measures to prevent any additional spread. In addition to that, we want to make sure that if you do have any type of flu-like symptoms, any of the COVID symptoms, we know they mimic one another, that you are contacting your physicians, that you are being evaluated if you do need to be tested. And also, as Tess mentioned, making sure that we get our flu shots. CDC is recommending that we get our flu shots before the end of October, which all of our staff, we are in the process of getting everyone vaccinated. And then if you're admitted to the hospital, we are recommending that all patients get that as well. So if you have not scheduled your appointment, please do to get that done. Thank you.
Okay, we only have a few more speakers, and then we'll open it up for some questions. Obviously, taking care of the children of Fall River is this gentleman's #1 responsibility. I was in Morton today looking at the classrooms and what's going on. Our schools are our front lines on this fight. Children have very impressionable young minds. They worry. They feel isolated, they're anxious, but they are in school and they seem like they're happy to be there, which is a plus. We don't want them home if they can come to school. But the next person is the steward of the school system in Fall River. I did want him to say a few words. Superintendent of Schools, Matt Malone.
So as the mayor stated, we're serving about 3,600 students. I need that thing you can stand behind in this thing. This thing's too tall for me. I got about 3,600 students every day in the Fall River Public Schools. When we opened, and we worked with our school committee, which is the mayor is the chair, we were the first district in the Commonwealth to serve the number of students that we serve. So we opened with more students than any other district in the Commonwealth. Other districts have now caught up to us in their slow rollout, but we thought we wanted to get as many students in person as possible to start the year. So now we're 6 weeks in. And I want to thank, from the bottom of my heart, all of our teachers, administrators, and support staff, because essentially we're running 4 schedules at once. We're doing the hardest work ever possibly done in education right now. It's educating 10,100 students both at home and at school in a hybrid model. It sounds impossible, and it actually is, but we're doing it. We're taking one day at a time, and we're getting there. I want to thank Tess and her team. Our lead nurse works with Tess every day. This just so you know, the mayor talked about they work 8 hours. No, they work a lot more than 8 hours. All of our teams we're working around the clock. What was it? What we have? Columbus Day a week ago, right? I went away for a day, came back, spent 6 hours on Columbus Day just on this issue with folks that had tested positive and others that we had quarantined. That's the daily grind. That's what we do. And again, I want to thank everyone for their 100% team effort and commitment. All in. That's the way we do it in Fall River. Our students are in classes. We're feeding them. We're educating them. We're dealing with issues as they emerge. Today we sent out some important information. For example, contact tracing. If someone tests positive, you got to participate. None of this, I don't want to tell you my story. You got to. I mean, we're teammates. So those days of keeping your information yourself are over. We need everyone, when you get called by a tracer, to please give that information, because it will, quite frankly, save lives. So help us keep the spread down. It's very important. For us, we've had, in the past 2 weeks, we have 12 employees that have tested positive that are now in quarantine protocol, and 1 student from our hybrid program. So we've addressed every of those according to protocol. We work very closely with the Board of Health and the Department of Health, and we continue to move forward. We are in, tomorrow, as the mayor just mentioned, week 2, heading towards week 2 of being in the red. We're looking at a 4-week average of red before we make other decisions as to what we will do. I will say our spread percentage within our schools is tiny. Amongst young people, it's even tinier, but it is still a reality. So at 8.6 is not a good thing, but we're going to keep moving forward for a period of time and have more discussion about next steps. But we are prepared for anything, meaning we can move on a dime as to our model and our reopening plan, and we'll be able to do that. I will say there is nothing that replaces a teacher in person in front of a class. I mean, it's sacrosanct, right? I mean, that's it. It's perfect. That's the leitmotif of our work. But I will say that we've made the remote, to the best of our ability, work. We now have, thanks to the purchasing of our school committee, we have 9,986 devices. I got 10,100 students. I got another 500 devices on the way. So we're one-to-one. We're able to provide the technology that's needed. Have 1,000 hotspots that we've put out, about 500 so far. We're doing everything we possibly can. I want to thank Ken Pacheco, who we should put a statue up somewhere in the city at some point for Ken, for the really amazing work that he's done to make all of our buildings COVID safe. That's on top of running $350 million of building construction and capital repairs across the system. So if you walk into our schools, as the mayor will attest, he was visiting today, we now have glass up, we have partitions up, we're set up in a way for maximum safety. And I will say, we've worked around the clock. We've invested time and resources in doing that, and we're doing the best possible job. This is not a perfect world. Doctors will attest this isn't a perfect science, but we're trying our best. We will continue to move forward, and we'll communicate. And with that, thank you, the mayor, for inviting me today, and I look forward to the rest of this discussion.
Thank you, Superintendent. The other 3 people over here to my right are the Fall River Legislative Delegation, along with Caitlin from Senator Roderick's office. I'd like to ask them to say a few words in no particular order. Alan, Sylvia, Carole, and then Paul Schmidt would come up. That'd be great.
This virus has affected every part of our lives. You've heard from education, healthcare, government, quality of life, recreation, every single thing that we do. We're 7 months into the virus. we probably have 7 months more to go by the time everybody's had an opportunity to vet out the virus, get the vaccine. We're all doing our very best to make sure we keep the resources flowing, support our services. But the only piece that matters, because we've proven we can be disrupted, we've been disrupted, is what you do. And I have been around the district. We all here travel around under good conditions, as best safe conditions. But I see it. I see people not wearing masks. I see people in close contact not wearing masks. I see people violating some of the norms that should be happening. We all do. It's simple. Put on your mask, stay away from big crowds, social distance, and wash our hands. It sounds like we're lecturing, but we've heard from not just we governmental people, but from healthcare professionals and public health experts. Please, to make these next few months as painless as possible, let's all do the right thing. Thank you so much.
Echoing those words, I just want to reassure people that it's important that they understand that for the past several months, we have been working closely with our mayor, with the Department of Public Health, the Board of Health here, South Coast Hospital. We receive a daily report as to conditions there regarding PPE, critical care. We're communicating daily with the governor's office. And as I said, the Department of Public Health, many of us are getting those numbers out daily as to how this chart is going, how our numbers are rising. It's extremely important that we follow all of those things that were suggested here by not only the mayor and my colleagues, but also the physicians who spoke earlier. It's not too soon to start thinking about holiday plans. This is going to be going on through Thanksgiving and Christmas. So it's important to start thinking perhaps of visitors coming from out of town and discouraging that, and limiting the size of celebrations to household members. Just a thought to start thinking about as we approach Thanksgiving and Christmas. We've never been in a position before where we had to deal with a pandemic like this during the holiday season. So, and of course, the flu shot. We know that the flu is on its way, and that people should be getting that flu shot. Very important. To have the flu and to have the possibility of COVID at the same time is a disaster. So please follow the instructions of your primary care physician. And what you've heard today, get out, get a flu shot, and please maintain social distance.
Well, thank you very much, Representative Sylvia. Dr. Hackner and Ms. Vieira, would you please convey to all of your colleagues at South Coast Health and St. Anne Stewart our appreciation for all they have done for us in the last 7 months, particularly those dark months in the spring, which we all remember so vividly, where case counts were rapidly rising. This was something new. We didn't have it figured out yet. South Coast Hospital outfitted an entire gymnasium at UMass Dartmouth to prepare for the rise that we thought might come. Thank God it didn't in the end. But all of you, all of your colleagues we know worked so hard. Please extend to them our thanks, and know that we're all doing our darndest to not put yourself back in the situation we were. Thank you very much, and thank you to the mayor. Thank you.
All right, guys, again, we want to thank everyone for coming out today. It's important that we get this message out to the community. We need everyone's help. We'll ride this out the best we can. Anybody have any questions?
Yes, surge planning. Are you planning for surge, and what can you do, or what have you done?
Well, our surge planning mostly is based around our hospital group. They're the ones that monitor the amount of patients that enter. what their condition is, and as Representative Schmidt said, we keep an eye on it every day. I've also been told that if we ever got into a really critical situation, we could get that hospital ramped up again at UMass Dartmouth very, very quickly. But let's all hope we don't go there. We're ready for any surge they give us. Go ahead.
Yes, sir. What about efforts to work with the homeless or people who live a little closer to the street?
Okay, to that end, we have expanded our homeless program in Fall River down to a Solomon's Porch on Bay Street. We just got done installing the appropriate showers, kitchen area, so that if we do hit a stretch there where we need to either isolate a patient or we need to get someone some additional treatment, that place is now up and running.
Superintendent, if we go into the red for the third week in a row, what is the school department going to be considering?
We need you in front of the microphone. Thank you.
Why, so you can see the top of my head? Great question. So we're going to continue to monitor. We go to 3 weeks in the red. I continue to stay in the, I am continuing to look at 4 weeks as a data point for decision-making. So 3 weeks for me, we'll continue to communicate and monitor, but at 4 weeks, I'll start really thinking about where exactly the upticks are. Are they outside of schools? Are they on hotspots? Are they contained in other places away from our school? And make those decisions. This isn't there's no boilerplate, that the color coding system is just one metric that the governor's office has released for us to use in making decisions. But we have said all along, we're going to be using the science, looking at our actual in-school data, and then making decisions. I've been talking just today with all the other superintendents in this region, and we're all facing the same situations where we're all in the red. We have students in schools. It's been safe so far, but we have to watch it every day. So, as I said, do not expect any announcements from me at week 3, but somewhere between week 3 and week 4, which gets me to the day after Election Day, November 4th. Is that Wednesday? That would be week 4, where I'd be able to really come forward and make some announcements in terms of where we are in terms of posture.
Would you just amplify a bit on the communication you said that you sent out today with the parents? And
No, I said I talk to other superintendents on a daily basis. So I talked to.
earlier on, when you first spoke, you said you sent something out to the school community today about.
We so you following us on Twitter, my friend?
No,
Well, you should be.
mentioned this earlier.
Yeah, well, get on Twitter and follow us because
I do
you might be my 6,000th follower, and that's what I'm looking for right now. We tweet out public service announcements every single day. One of the things that when Tess and I spoke about today was the issue of contact tracing and folks being fully upfront, transparent, and honest in who they've been with and those kinds of things. It's very important for us that everyone, like we're all working together. So the announcement I sent out today was about the importance of A, if you have any symptoms, stay home. B, if you test positive, please participate in contact tracing. Be upfront, honest. It's the only way teammates, such as we all are here, will get through the important work. So we're doing those kinds of announcements daily. In terms of what we're communicating with parents, if we have a positive case in a school, we send home a letter that goes to the families and all the employees in the building. We've been doing that practice since the summer with our summer programming. And, people will continue to test positive. We will continue to respond. We think we're being safe. And we want to thank the city for being partners with us in that.
Can you expand more on the 12 positive cases who were?
I cannot say anything about who those people were. I can tell you that I have 12 positive adults and 1 student. It's all been tested. And again, this is all from information we have is outside spread in the community.
Is this the start of the school year?
Yes. Nope, sorry. That's in the last 2 weeks. There was a couple before that. Remember, things are measured in 2-week spans, so it's 14 days because of the quarantine. Now, just so you know, and we can be clear, a positive case leads to other folks quarantining until there's tests, if there's close contact. So we deal with that every single day. I mean, that's when I say this is hard work, and our people are working around the clock. It never ends. Mayor Coogan can tell you, he gets emails and texts from me constantly, just communicating and letting everyone know where we are, what we're doing, and what our status is. And that's the new norm. I hate that term. You probably do too. What is that, a colloquium? What is it? Help me out. I don't know how, even what that is. I'm asking my former Durfee All-Star, but I tell you, it's something that now, our daily disciplines are making sure we're tracking, recording numbers, communicating, and continuing to stay calm. I mean, that's the bottom line. Sometimes people want to freak out. Everyone wants to run around and say, oh my God, we don't do that. We look at the science, we look at the facts, we stay calm, and we move forward.
Anything further? Keith?
I do. I have a question for Tess. Contact tracing. Are we seeing anything specific? Churches, perhaps. Is there anything where we can identify why we went up into the red?
We are seeing, again, when folks are going to a workplace symptomatic, we're seeing spread in workplaces, as well as small gatherings within the home of friends and family. That's the bulk of where our cases are stemming from right now. It's when people are letting their guard down, having a group over for, Saturday dinner, or again, a workplace situation. So that's why it's critical to not go out when you're sick, as well as not letting your guard down, thinking that, your friends and family are safe. No one is unfortunately safe from COVID. It's impacting all age groups throughout Fall River. So it's critical that we limit our exposure to other individuals.
So you haven't seen any particular gathering that's happened in the city that you can really say there were a couple of cases right there, a couple cases right there?
Again, it's mostly within private homes, or workplaces where employees are going to work sick.
Keith?
Yeah, Halloween is a week and a half away. On Friday, the Board of Health released some guidelines to that. What can you tell the families in Fall River about, trying to celebrate the holiday of Halloween, but also being safe at the same time?
No, Tess wants to come up. I'm telling her to wait a minute. We know how, trick-or-treating is a high-risk activity, but we're not banning it. We're not telling people they can't do it. We'd love it if parents went out for an hour in the afternoon with their kids and did not have any contact with other groups and did it respectfully and safely. That's probably the best case scenario. But we do urge people to have a little house party with the family, or try some trick-or-treating in the basement, do something at home. We're not banning it, but we're not encouraging it either. Is that it? Joe?
I do. As you said, or as some folks said here, that they're seeing people without masks. Is there any discussion about fines or some sort of way you can control that?
Well, I've seen a marked increase in mask use. I go to Market Basket, or I go to Shaw's, or even Stop and Shop, and everybody has a mask on now. I think the reason we're getting hit, as Tess pointed out, is people go into houses. 6 or 7 people go into a house for a small dinner gathering. Nobody wears a mask. They're just guests. People go out with close friends and interact with others. They're my friends. I'm not worried about it. I think when you look at a place like this today, everybody's got a mask on. I think that that's not the issue. I don't think people are in stores. I don't think people are in churches congregating, not wearing a mask. I think it's more the individual with their friends that's spreading this right now.
So you don't see any sort of
Well, again, if Tess tells me that we have, we're getting hit on poor mask usage, then we'll adjust as we go. We've been adjusting for the last 7 months, and we'll continue to do so. But right now, I think we're doing okay with mask usage. Okay, guys, thank you very, very much. I appreciate everybody coming out.